Hernias can be a confusing medical issue, especially when it comes to understanding when surgery is necessary. In most cases, surgery is indeed required, particularly if you experience persistent or worsening pain, observe a growing bulge in the affected area, or face the risk of strangulation where the blood supply to part of the intestine is cut off. These conditions are considered medical emergencies, demanding immediate attention. Even if a hernia becomes incarcerated, meaning it cannot be pushed back easily, surgery becomes an urgent necessity. However, for small, asymptomatic hernias, especially in individuals over 50 with existing health conditions, surgery may be delayed or avoided altogether. In such cases, the doctor might recommend a strategy known as watchful waiting, particularly if the hernia is stable and does not cause discomfort or complications. Age brings about increased risks when it comes to hernia surgery, making preoperative evaluations a vital component for individuals over 50. A thorough cardiac evaluation may include tests like an ECG or an echocardiogram to ensure the heart is fit for surgery. Additionally, it is crucial to check blood sugar levels, particularly for diabetic patients, as well as assessing kidney and liver function. Pulmonary function tests are also recommended for smokers or those with pre-existing lung issues. Finally, a medication review may prompt adjustments for blood thinners and other drugs that could complicate the surgical process, alongside an assessment of the patient's fitness for anesthesia by an anesthesiologist. Once surgery is completed, whether through open surgery or laparoscopic techniques, post-surgery care becomes paramount. During the first 1-2 weeks following surgery, pain management with prescribed medications is necessary. It's also essential to keep the wound site clean and dry, while watching for signs of infection such as abnormal redness or swelling. Heavy lifting should be avoided for 4 to 6 weeks to prevent putting strain on the surgical site, while gradual movement, including gentle walking, is encouraged to reduce the risk of blood clots. Eating high-fiber foods and staying hydrated are crucial to avoid constipation during recovery, which could exert pressure on healing tissue. After about 4 to 6 weeks, patients are generally able to return to their normal activities, but should refrain from strenuous exercises unless cleared by their doctor. It is crucial to monitor for any concerning symptoms post-surgery, including fever, nausea, severe abdominal pain, or a recurrence of the bulge. In summary, understanding when surgery is needed for a hernia, taking appropriate precautions for those over 50, and following proper post-operative care can significantly impact recovery and overall health. Stay aware of these warning signs, as they can serve as indicators for seeking further medical attention.
Advice. The content available in our YouTube videos or on our social media page like Instagram, Facebook, and X do not provide a diagnosis or other recommendation for treatment and are not a substitute for the professional judgment of a healthcare professional in diagnosis and treatment of any person or animal. We intend to provide educational information only.